Hello, folks, and welcome to another installment of Risk Unfiltered. Glad you can join us. I have the privilege and the pleasure to have a conversation with someone I admire, both in terms of her expertise and her service and her personality, Dr. Joy St. John. And I
For
say,
that
welcome, Dr. Joy.
stunning intro.
Welcome, Dr. So let's jump right in. So you are the former executive director of CARPHA.
Yes,
Um,
that's true.
and I
5 years, the first woman.
first and I know you're still active in the public health space. Um,
Yes, global public health with a focus on pandemic preparedness and response is my main occupation. But I
okay,
still do forays into things like climate change.
okay. Well, let's jump into that. And there's been um oh well let's get the people risks out of it first before we jump into some more global public health question. The selection of Robert F. Kennedy Jr. as Secretary of Health in the current President Trump's administration
Cabinet.
cabinet, and given his past and present pronouncements on things like vaccines, particularly most recently measles. What is your take on that? On the person and where your stance is that the vaccine for measles or is not necessarily a quick fix.
So I am going to quote him or paraphrase him. He
Mhm.
said that the Americans should not be taking advice about health from him. And
Okay.
when it comes to vaccination, as a public health practitioner and a former expanded program on immunization manager for Barbados,
Mhm.
I know that vaccination is a lifesaver. And in the case of measles, this is something that was building for a while. In 2020, I wrote something saying that vaccinations overall had plummeted 70% in the US. And as soon as you see that type of thing, you have to look out for outbreaks. The vaccine is essential for that core cadre of vaccine preventable diseases. Measles is one, rubella is one, polio is one. Without them, you will have the disease raging wherever there is a vulnerable population. So you have almost a perfect storm, a rising tide of vaccine hesitancy, and a plummeting, for want of a better word, a plummeting interest in public health and science. Public health is one of the most exact sciences in medicine. And when it comes to vaccination, that is the most exact. And so we are seeing now the issue of that measles outbreak shockingly going overboard in a country with an exemplary health system
Yeah.
for curative care. They
Yeah.
have never been really as strong as they need to be for preventive care, which includes vaccination. And because he is a leader, even though he says, don't take advice from me, and because he has been against vaccination
Yeah.
in some form or fashion, and um, not least of which measles, I think we are going to see, unless things change drastically, I think we're going to see a continuing epidemic already persons who were infected with measles have come into the CARICOM space and caused importations. Thankfully, the resources of the expanded program of immunization of the CARICOM region have been able to wall off and stop the disease, measles, becoming entrenched in those countries that were affected and stopping local transmission, which is where you know that you're in trouble. So I would like us to move away from personalities and let's talk more about principles.
Yeah, but to your point, and you made it pretty clear, notwithstanding his comments, but personalities or people risk comes into play because they will follow
Definitely.
yeah. So with all the respect and love in the world, personalities come into play.
Most definitely. I can remember when I was immunization manager, whenever I got wind of a child of school age, their parent refusing to have them vaccinated, I used to bring the whole family in and discuss it. And then if they still refuse vaccination, I used to keep a register of the children. So I knew where the vulnerable points in the island were if we had importations.
What would
So
be, well, I'm sorry, but what would be some of the reasons or rationale parents would not want to, during your time, would not want to immunize their children? If you remember that.
it's one of the things that is played upon by persons who are against vaccination. There is a
Okay.
feeling that it is unsafe to take. There's a feeling that it can be infused with elements that can in some way cause
Yeah,
genocide. There is a feeling that herbal solutions
our
can
best.
be good alternatives. That's not true. There is also, in some cases, a link to religious feeling, and I'm thinking here of human papillomavirus. There has been the erroneous thought that vaccinating with the vaccine against human papillomavirus can encourage promiscuous behavior. And so there has been a religious overlay for that one. So there are a variety of reasons. Plus, there are also segments or sects, SECTS, which are against vaccination, just like we
Right.
have a religion that is against blood transfusion. So
Yeah.
there's a whole host of reasons.
What are some of the other, more specifically in the Caribbean, what are some of these old diseases that we are seeing a resurgence of? So measles
Well,
is one.
the first one that comes to mind that most people know about is this whole issue of tuberculosis. And it
Okay.
was linked to persons who were HIV positive or otherwise severely immunocompromised. But there's another interesting one, and it's from biblical times. And I want you to guess what is the disease that is mentioned in the Bible that you think could make a resurgence?
Not leprosy though.
Leprosy.
Kick rocks.
I'm not kicking rocks.
Oh, wow.
And the issue here is about personal risk. There's so few of them in the Caribbean islands that still have leprosy that they're usually trapped by the system. And there are some people who just don't want to admit that they have leprosy, do not take the medication, which is very effective if you take it all the time and in the way that it's prescribed. And they can have resurgences because the medication keeps it dormant,
Moment.
keeps the system under keeping the leprosy under control. And so here again,
How is that transmitted
personal
though?
risk,
How is that transmitted? Leprosy.
touch,
Contact.
constant touch, contact. And it's not just casual contact. It's not something that's disseminated in the air that COVID, in the way that COVID was. It is constant contact. But let me say, diseases have a way of
Morphing.
transforming
Yeah.
exactly. And
Yeah.
this is what happened with mpox. It used to be called monkeypox. It's
Monkeypox.
no
Yeah.
mpox
I remember you
because it's
correcting me.
so
Yeah.
different from monkeypox. That used to be something that you had to have prolonged touch. Now it has transformed so that sexual transmission is one of the risk factors. And that was not an issue in the past.
Well, look at that's why I tell folks I'm not a risk expert. I'm a risk practitioner and a lifelong learning. Here I am thinking monkeypox was changed to mpox just because it wanted an abbreviated term or they wanted to
No,
stay.
no, no.
So it was changed to
There
mpox
is that
because of,
issue of stigma and not
right.
wanting to focus on an animal, but it
But
is a new disease.
oh,
What was declared a public health emergency of international concern is a newer disease than the original monkeypox that we would have known of, say, 10 years ago.
so where are we? Where's the Caribbean right now? We can touch on it globally a bit, but where how protected? Well, that's kind of like a heavy word, but in terms of detection and treatment for mpox, let's start there first, and then we'll come to leprosy.
The
How,
Caribbean has the skills. The Caribbean has had several scares from the north to the south of the Caribbean. There have been individual scares, but there has not been any mpox taking up residence in countries and having local transmission. So the index of suspicion is high, and the way to manage it is there. And there is a CARICOM-wide approach. So there's consistency, and there's also the communication between the islands. So they make sure that they know what is happening because it's often connected to travel. That's how it's
yeah,
imported.
but Dr.
And
Joy,
so
why isn't more of this in the public domain?
I'm not sure
If you have to guess, because
when I was at CARPHA, I did
yeah,
a media briefing and they then the media then used it because I wanted them to be judicious and not
yeah,
to sensationalize it. The media took it. We've had sessions with the chief medical officers, but to be fair, it is not as much as of a risk as other diseases
right,
like avian influenza, the fact
okay,
that we're still having our cycle outbreaks of dengue, etc. So
right,
because there are few resources, we focus where there is that clear and present danger.
yeah. But if I may, and put and and so from a part-time constituent of the Caribbean, um, knowledge, and I know you'll agree with this, knowing or recognizing there's a possibility that you can be impacted by a disease, i.e., a risk. And again, you don't want to be alarming about it, but as I sit here now, you have raised my risk radar as it relates to, and again, and being totally honest here, I did not know that leprosy, and for the listeners, we are not, again, this is Dr. Joy and myself is not always saying that it's a bad thing,
Or
but it
for the
exists.
Caribbean, one case of leprosy is an issue.
Of
And
course.
so there is always that background level of index. And I can
Yeah.
remember that there were education sessions, but right now the world is just full of
Crazy.
outbreaks. And
Yeah.
so we have to avoid inundating the general public in such a way that they switch off, which is quite
Yeah.
possible. So you focus
Yeah.
where you need to focus at the time. The things that I have mentioned to you are under control through the public health
Okay.
resources. I keep saying public health is a very exacting science.
Yeah.
It is not understood of in the way that clinical medicine, surgery,
Right.
nephrology is understood. but it is so scientifically exact that it saves populations rather
Right.
than individuals. So the public health measures are in control.
Okay. Well, what would be on you? So let's move mpox and leprosy aside. Leprosy is still, you know, that's going to reside in my headspace free of rent for a
I used
while.
to read
But
about demon and leprosy to my children when they were really small, when I
yeah,
would use the Bible stories. So, but
but what,
I knew at that time that there were still burnt out cases. They're mainly burnt out cases, but
what causes leprosy? What's the,
there is actually an organism, so you have to contract it through
oh,
prolonged contact,
contact.
and it actually numbs your extremities, and without the ability to feel, you can have injuries that make you lose a digit and so on, a toe and so on and so forth.
Right.
And if
Okay.
it spreads more, it can cause other issues. But like I say, that is something that public health has under control. So we're leaving monkeypox and leprosy aside. What are we going to next?
Yeah. Well, no, you tell me what in the public health space, I don't want to use the word worries you, but what's on your radar as it
What's
as
on my radar?
yeah, from a
What's
public
on my
health
radar in terms of diseases and
yeah.
conditions would not be infectious. It would be non-communicable diseases.
Okay. Well, let's go there. So I'll read you something.
The pandemic really did a damage to the
Yeah.
programs because
Yeah.
programs were not just about treatment, although it's very important to have treatment, but the programs were also about prevention. And
Yeah.
in the interim, we have more and more younger people, and in
Yeah.
fact, even children, having the risk factors of non-communicable diseases. And we have been unable as a region to get warning labels on food packages so people have the ability to know what is a safe food to eat or not.
Yeah.
And so there is a whole setup for much more non-communicable diseases affecting younger and younger people, which was not how it came on the scene. Originally, heart attacks and diabetes were things of older people.
Yeah. Yeah.
Now we have younger men under 50 getting heart attacks and dying at increasing rates. So non-communicable diseases, that's what's on my radar.
Okay. But that is lifestyle, one.
It's
Um,
lifestyle and it is also environment and it is also political will to
well,
restrict
yeah, yeah.
the things or encourage the things that allow people to have
But
healthier lives.
where does education come in? So we're talking younger, even kids now. So where does educate, what role can or does education play in
Huge
impacting that?
roles.
Okay,
I
and
always
where's the Caribbean with that? The Caribbean schools
Okay, so we talk about that.
yeah.
So I always say in the Caribbean, we will have death by appetite.
Oh,
We have wonderful food in the Caribbean, and most of it, the original foods, were heavy on fibers and so on. And we used to have very active lifestyles.
yeah.
So
A
let's
compensating
tackle the
factor there. Yeah,
food. Let's
yeah,
tackle the food. So
yeah,
education includes not just talking to children and parents, but also educating the canteen owners and the cooks and so on,
yeah,
so that they prepare healthier foods. But then they'll come back and they'll tell you, but mom, if I don't have the greasy fried chicken and the greasy chips, the children not going to buy the food. So the other way that education comes in is education of the persons who import the basic ingredients, because unfortunately, a lot of the Caribbean imports most of
yeah,
its food already
yeah,
processed and
yeah,
therefore heavily adulterated with sugar, salt, and fats. So we try to educate the manufacturers and the importers and try to see if we can have whole industries moving as one. For example, if you've got a population, like the population I live in, accustomed to very sweet sodas, if only one manufacturer or importer reduces the sugar in the product that's consumed, people will move away from that manufacturer. So this is one of the areas where I am very sad to see that the baton has been dropped, because we had an initiative which was endorsed by the COSOD, the Council of Health Ministers, and the COTED, the Council of Trade Ministers in this instance, which allowed countries to come together and find ways that they could reduce the importation and the manufacture of foods high in sugar, salt, and fat. We are far away from where we could have been, where we were on track for.
Why was it dropped?
There was heavy infiltration of the private sector into the
lobbying
process.
Yeah.
And as a result, you can surmise that there must have been lobbying of forces that could influence this whole process.
Okay. Well, where is enough said. Where is but we'll come back to that in a second.
Where is?
Yeah, so no, I'm trying to choose my words very carefully so I don't get you into trouble.
Well, that would be very difficult because I can refuse to answer.
So let's go back to personalities for a second. And it's all in line with the two topics we touched on thus far, the non-communicable diseases and diseases that have come back up after being dormant for so many years. So the US has decided it's not going to support or fund WHO. So in my head, is there downstream or cascading impact to the Caribbean organizations who depend, i.e. CARPHA, and the other one, what's the Caribbean thing, that relies on WHO for funding for the most part? I mean, there's funding elsewhere. What's the other Caribbean?
No, there is not funding else.
I mean, but no, the European Union will do some stuff independent. No? So the majority of funding for places like CARPHA. And what's the other larger organization after CARPHA before we get to WHO?
PAHO.
PAHO. So is PAHO directly impacted by the reduced funding or the withdrawal from the US to WHO?
So the Pan American Health Organization is an older organization than the World Health Organization. It is the specialized organization for health of the Organization of American States. So Pan American Health Organization also has the US as one of its members. The US has not pulled out of PAHO.
Oh.
But because PAHO supplies the coverage for the Americas region for WHO, this is done through the Americas Regional Office of WHO. The portion of the US funding that would have come down to PAHO has affected PAHO. And PAHO has done a series of measures, the usual things that you would expect, restricting travel, restricting large meetings, having them virtually rather than in place. And also there's probably going to be some curtailment of the human resource element, because in health, paying people, especially well-trained people, is expensive. But then that has been curtailed, but their operations, thankfully, are still more or less preserved.
And and what about, as far as you can ascertain or know, if you do, is there similar impact to CARPHA by way of?
Well, before I left, I had been negotiating considerable pots of money for selected programs that are normally underfunded. And I have not seen any movement with this. I have not been in communication with the new executive director or the executive management team. But it seems as if that money would have stalled. And there were also CDC funded projects. So CDC took a hit. There was also USAID. In terms of global effect, the combination of withdrawal from WHO and the withdrawal of the USAID funding has been catastrophic in many countries across the world.
Including the Caribbean.
The Caribbean, I'm not sure about catastrophe. You know, CARPHA is the specialized organization for health for CARICOM. CDEMA is a specialized organization for disaster preparedness and coordination in those lines. And then we've got the other members of the security cluster, RSS and CARICOM impacts. Collectively, there may still be a way of resourcing several of the things that we need. We have the upcoming hurricane season. It was a joint effort mainly between CARPHA and CDEMA in certain instances, and they would rely on other partners, et cetera, et cetera. Maybe collectively, the power of collective, the economies of scale may have cushioned the Caribbean a little bit, but I don't know. I am not moving in those right now. But I can tell you as a rule of thumb, if you're talking about risk and we move out of personal risk, putting all your eggs, which is what a lot of countries were doing, putting all of their eggs in the US funded basket was a risk, and it suddenly came as an actual hazard earlier this year.
Would it not, and hopefully it doesn't get to that point, but as funds dry up and there's no more contributions coming from the US into these global organizations, would it not be plausible or logical to think that the services provided by the CARPHAs and the PAHOs would be impacted?
So I'm going to go back global now. So there has been a domino effect, not only on WHO, but there has also been a reaction from the United Nations, so global governance writ large. And there is going to be a shrinkage to what is the core function. So the Director General, Dr. Tedros, would have made some comments at one of the governing body meetings that's going on right now, talking about how they are trying to curtail not just the HR, because they have enormous numbers of very specialized persons employed at WHO. So they're going to shrink that. They've already announced from June 16th that instead of having 12 assistant directors general, there will be now 5 or 6. And then there is going to be a shrinkage of the departments from 74 at headquarters, from 74 to 36, something like that. So that type of action is going on with a focus on the core. And he also made a request for persons not to ask for additional things other than what has been funded. Luckily for him, he got a budget increase. And with a promise for an increase, not as a one-off, but over time. So that may assist in the critical areas.
Okay, well, let's, because I know if we can go back to CARPHA,
I can only speak about what I knew.
I know. No. So because my thought was, given a lot of the preventative stuff that, and again, having done some work with you when you were there, your testings and the work of the laboratories and they do. One can only hope that those areas aren't
Well,
impacted.
let us talk about the fact that CARPHA had two streams of funding from the member states and from the international development partners. And among the international development partners, there was an interesting range of support from many areas, not all the US. And so I am hoping that, and at the recent CARPHA conference pre-meeting, they launched, I think, two more projects from what I saw on LinkedIn. So they have expanded the range of funding coming in for specialized programs. So I am hoping that this will be the way in which entities such as CARICOM institutions will find a way to bridge the divide between what they had and what is needed.
Okay. Well, yeah, let's hope for the best, but being a risk practitioner, prepare for the worst as best as we can. Let me ask you, and I know you're gonna probably take two steps back. Let's chat a little bit about your time at CARPHA. And I am privileged to have worked with you during that time. But I want to give you an opportunity without prejudice and without making you bigger than life. If you have to pick the top three accomplishments during your tenure, from whence you started to when you left, what would be those top three accomplishments be?
The first thing is that we got the first increase in CARPHA quotas during my tenure. There had been several requests from the previous executive director for increases in quota, but they were never granted. But the increase in quota was granted for CARPHA. And in fact, when we presented it to the COSOD, members of the COSOD were very glowing in their praise. And there was also a request for more money, but I think things have changed now. So that would be the first thing.
Okay.
The second thing would be, and I'm going to put two together, so I'll cheat a little. Second thing would have been the nimble way in which CARPHA responded with a Caribbean tailored attack on COVID in such a way that we had measurable success during the pandemic in reducing the number of lives lost and the amount of illness. And also after, because of the tourism and health program, there was this amazing bounce back to tourism. The tourist levels went right back to 2019 and in some instances surpassed 2019. And implicit in that would be that CARPHA was chosen to work most closely with the White House over the donation of Pfizer vaccines. So that whole process of negotiating with Pfizer on legal agreement, getting the member states trained, because the English-speaking Caribbean, the independent Caribbean, because the UPOTs were getting that from the motherland, had not been prepared for dealing with ultra cold chain vaccine like Pfizer. So there was training, and here we collaborated with PAHO. And also the actual logistical issues of getting the different tranches to the countries. I can remember us buying a freezer to store the vaccine, and there was no vessel that we could find to take it to the country. We eventually settled on a ferry, that type of thing. That I see that as a massive achievement. And then the third thing would be the increase in trust and the increase in technical prowess of trust in the staff and technical prowess of the staff during my tenure. So when I came to CARPHA, there were all of these awful stories about how CARPHA couldn't perform. I had to surrender grants because they were not executed in time. And I was told point blank, there was no way that I could attract any staff of caliber to do the work that was necessary for CARPHA. But at the end of my time, all of that talk was done.
Yeah.
And CARPHA was performing. So I would say those were the three. One was this whole issue of an unexpected pandemic and knowing what to do Caribbean style for the Caribbean people. The other was a focus on the staff and the trust in the staff. For me, trust is a tangible. If people don't trust you,
especially in your space,
they will not work with you. And because of the trust and the way in which we supported the Caribbean, then we got the increase in quotas.
Well, Dr. Joy, I'll take all of what you just said and I'll put it in one bucket called leadership. Leadership. And again, you know, having spent some time working with you and your team, and we can speak specifically about the implementation of enterprise risk management at your organization. I have now done this across almost 4 continents, and you probably will go hit the bottle after this, after I say this with joy, no pun intended.
You mean the juice bottle, but go on.
With most things in an organization, whether it's risk management or access to funding or hiring, leadership counts. Leadership counts. And without the right leadership, the possibility of success diminishes exponentially. And I have case studies that I can discuss or share when leadership is lacking. And to that, and to the points you made about increasing your quota and the nimble way you, as the leader of CARPHA, was able to take not just the institution CARPHA, but the Caribbean nations, guide them through the epidemic and dealing with coordinating the access to Pfizer vaccine. It's about leadership, but knowing how humble you are, you would not say, although the question was during your time, but I would say without fear of contradiction, because having worked with you and how you took ownership and leadership with something that relatively was new to you when we talk about enterprise risk management, and how you grasp that and became a force multiplier is to be commended. Yeah.
Thank you very much. But I will say,
no, don't say anything else.
I will say that
It's not a compliment, it's a fact. Yeah.
I will say that I'm a woman who loves her work.
Yeah.
And I would also say that being an executive director at CARPHA was the best job that I ever had up to that point.
Right. Yeah.
But what you saw was my love of learning.
Yeah. Yeah.
The way that your company imparted the information, the way that you did special attention to certain departments, really piqued my interest. And so I responded in kind.
Yeah, well, I think it not just in kind, I think, and to that point about the learning aspect. So I tell folks, when we talk about leaders, don't be all knowing, be all learning. And with that, if I don't stop now, I'm getting little plugs, Mr. Hackshaw, I can continue this conversation. And it's not because the information is it's very instructive, informative, and for me, educational, because when I'm hearing about leprosy, and I love that term, I'm going to use it with your permission, death by appetite. So Dr. Joyce and John, it continues to be a privilege of mine to know you. Our paths, God willing, will cross again in the work environment. That I can say to you. I hope when I do call, you are available and willing. You're always able, but to whom much is given, much is expected. So I want to thank you for taking the time.
Want to thank you for being more gentle with me than I thought you would.
No, it's the new look of Joyce and John, and I know certain folks from CARPHA and WHO will be listening to this. You have a glow about you, and if not for certain things, I'll probably intimate there may have been a reason for that glow, but we can't go there. But
It is that I now
seriously
have
though,
time. I now have time to exercise and
well, it's
spend time on
working.
me, but I am
Yeah,
also doing a work function, which I absolutely love.
which
I've been
is
lucky again.
you want to share?
So it was something I was doing before.
Hmm.
I'm the vice chair of the technical advisory panel of the Pandemic Fund, which is housed in World Bank and chaired by WHO.
Interesting.
Dr. Chikwe Ihagweso is the chair. So I do that virtually. It
Uh,
takes up a lot of my time, but it is part-time work. And I absolutely love it. So what we are working on is we actually review the proposals from countries to get funding from the pandemic fund for pandemic preparedness and response. And we have been working on upgrading, refining, improving the template, the way in which we will get answers from the member states and linking it to monitoring and evaluation and the overall results framework. So we've been doing a lot of system improvement in these last months. And we've launched the first phase of the third call, and we're just about to launch the second phase of the third call. And then we'll start reviewing papers very soon. Well, Chikwe and I don't actually review papers. We support the TAP, but we don't actually review papers. So that's what I've been doing. It has been a lot of
but
intellectual work.
but you know what that raises, and we have to spend a few minutes on this before we log off. But how prepared, and choose your words very carefully, how prepared is the Caribbean for the next pandemic? Not if, but when the next pandemic hits.
So the Caribbean, actually CARPHA was one of the recipients of funding in the first round. And then again, some member states of the Caribbean again got funding through individual country projects. And also there was the OECS from PAHO got supported in similar project to the one from CARPHA. So all of the building blocks are there for building on the foundation that was started during the pandemic. While the pandemic was actually going
COVID,
on,
yeah.
there was a lot of capacity building and instrument and equipment procurement through a lot of grants that we had from at CARPHA. So they really should be a lot further along. But I will say generally, although they went through a pandemic, public health institutions across the world are not as prepared as you would think. Part
Go
of
on.
that is that you cannot fight a pandemic in isolation. And in this last year or two, there has been a negotiation of a pandemic treaty, which they've just agreed on in the working group, and this will be endorsed at the World Health Assembly. So there needs to be a better way of working together. There were always countries that have more and tended to hoard the vaccine in the last pandemic. That type of thing always threatens countries that don't have a lot of resources. And so the level of global preparation is not as good as it should be. So I'll just say that writ large and not focus on the Caribbean, but the Caribbean has been well resourced in terms of the pandemic fund and the projects that have been funded.
Right.
Not through me. There's no conflict of interest. I
Okay.
separated myself.
Exactly. And so one can only hope that that lessons would have been learned, and where there were deficiencies identified during and or post COVID, that those holes are being plugged. One can only hope.
Capacities of implementation
Yeah.
are always there.
Yeah.
And you need, therefore, the regional level to support, which would be CARPHA. The PAHO, America's regional segment of the World Health Structure, to also support. So these layers of support are important for countries that don't have many resources, like in the Caribbean.
Yeah. A deep dive. Dr. Joyce and John, former executive director of CARPHA, I'd like to say a friend and colleague, thank you much.
It's been fun.
It is learning but fun. And we'll talk soon.
Okay, bye.